The latest WHO report on global antibiotic use reveals a deeply concerning trend. The antibiotics most responsible for fueling drug resistance are still being overused, and not enough is being done to halt this slow-moving catastrophe. While the report is structured as a measured call to action, the underlying data paints a far more urgent and troubling picture of a global health system that continues to sleepwalk toward a post-antibiotic era. The misuse and overuse of powerful antibiotics, particularly those in the watch category, are undermining the very foundations of modern medicine, and the international community is falling behind on its commitments to rein in the crisis. At the heart of this crisis lies the basic failure to prioritize the right types of antibiotics. The WHO's own AWARE classification system clearly lays out the framework. Access antibiotics, which are narrow-spectrum, cost-effective, and less likely to cause antimicrobial resistance, AMR, should be the default choice. They are appropriate for most common infections and carry a relatively lower public health risk. Yet, despite international promises, including at the 2024 UN General Assembly, to ensure that 70% of global antibiotic use falls within the access category by 2030, only one-third of reporting countries and territories are on track to meet that target. This failure is not just a missed benchmark, it's a systemic collapse in antibiotic stewardship. Watch antibiotics, which are broader in spectrum and more likely to drive resistance, continue to be used at dangerously high levels across many countries. These drugs are supposed to be reserved for more severe or complicated cases, but instead, they're often used indiscriminately, contributing to the rapid spread of resistant pathogens. The reality is that watch antibiotics are frequently used where access options would suffice, or worse, when antibiotics are not needed at all. This over-reliance is not just a technical issue, it is a lethal mistake that jeopardizes lives now and in the future. Equally alarming is the underuse of reserve antibiotics in low- and middle-income countries. These medicines are meant to serve as the last line of defense against multi-drug-resistant bacteria. Yet in many parts of the world, they're simply not available. That's not because they're not needed, it's because the health systems in these regions are too weak, too underfunded, or too poorly supported to procure and distribute them. The result is that even when patients face infections resistant to all other drugs, they are left with no treatment options. This isn't just inequity, it's abandonment. The WHO surveillance system, GLASS, is an important tool for tracking the crisis, but its reach is still limited. Less than half of countries globally are even participating in data collection. Even among those that are, the data is patchy and uneven. Many low-income countries, the very places where AMR is likely to do the most damage, are absent from the dataset altogether. Without comprehensive, global data, public health officials are essentially flying blind in their efforts to combat AMR. The consequences of unchecked AMR are catastrophic. When antibiotics no longer work, routine infections become life-threatening. Common surgeries become high-risk procedures. Cancer treatments, organ transplants, and neonatal care, all of which rely on effective antibiotics, become increasingly dangerous. The loss of antibiotic efficacy is not a hypothetical scenario. It is already happening in hospitals and clinics around the world. Patients are already dying from infections that no drugs can treat. And yet, despite this looming disaster, global action remains timid and fragmented. Stewardship programs that could curb overprescription are inconsistently implemented. Prescribers continue to reach for broad-spectrum antibiotics out of habit, pressure, or lack of awareness. Pharmaceutical development for new antibiotics remains grossly underfunded, while existing essential medicines are still out of reach in many low-resource settings. The entire ecosystem surrounding antibiotic use is broken. The WHO's recommendations for improving data collection, promoting stewardship, and ensuring access to essential antibiotics are important steps, but they are only a beginning. What is truly needed is a shift in mindset. Governments must treat AMR as the existential threat it is, not just another item on a long list of public health issues. That means stronger international coordination, stricter regulations on antibiotic sales, real investment in new drug development, and a fundamental overhaul of how antibiotics are prescribed and distributed globally. The longer the world delays, the closer we move to a future where a scraped knee or a simple urinary tract infection could once again become a death sentence. This is not alarmism. It is the sober reality of a world where drug resistance continues to outpace our efforts to contain it. The WHO report is not just a warning, it is a red siren in the night. Will we respond in time?